So which dry eye treatment is the best from a doctor's point of view? I'm here with Dr. Aaron Smith from Stone Canyon Eye Show, and we're gonna go down a list of the most popular dry eye treatments out there, and we're gonna rank them. We're gonna rank them on how we think they actually treat dry eyes. What success have we seen in our patients, and other things to consider, you know, cost, availability. So yeah, we're just gonna go over this list and shoot out what our opinions are and how we would rank them. Let's focus in. So a little bit of a disclaimer, we are just sharing our opinions and experiences, what our patients have experienced. My opinion might be completely different than Dr. Smith's, and also completely different from your doctor and your own experience. This is where it kind of gets unique with dry eye, but we just kind of want to go through the list and share our own opinions and experiences, so let's do it. Number one on the list, artificial tears. This is probably the first thing that an eye doctor is going to bring up when talking about dry eyes to a patient, and I would put that on a ranking. So we're going to rank from 1 to 10, 10 being the best. I would put it smack dab in the middle at a 5. The reason being is it's not that great. It's kind of a band-aid to the issue, temporary relief, maybe only last for a little bit, but also on the flip side, also very important to use, because if you're not using the artificial tears, your eyes can tend to kind of spiral out of control. They can be exposed a lot more, cause a lot more keratitis and dry eye patches, especially if you're using the computer. So important to use, but not one of the big guns as far as dry eye treatment is concerned. What would you say?
Yeah, and I'd probably give it about a 4.5. Can we go decimal
points.
Numbers?
Yeah.
I'm gonna go a little bit below because I know that artificial tears, they help for sure, and they'll get you out of a bind for sure. In certain situations, you're traveling, you're driving at night, even if you've had some specialty dry eye treatments, you still might need that drop because you've got hot air blowing on your eyes at night for 2 hours in the middle of winter, a heater, a lot of circulating air. But at the same time, artificial tears are recommended and prescribed so much as the primary treatment for it that everybody feels like, oh, I got dry eyes, I just got to go to the store and buy some artificial tears. You know, they're being recommended by probably primary care providers. Maybe your pharmacist is going to recommend an artificial tear to you. Some of them have preservatives in them that sometimes you put them on your eye and they burn your eye. And so, yeah, I'm going to give them like a 4 to 4.5 as a dry eye, because really I think your tears are probably your best, but I'd go close to you on that one.
Okay.
Yeah.
So next on the list, number 2, warm compresses. Now this one's tricky because warm compresses, I actually do them myself quite a bit, and I probably will put them at a 6 out of 10. That might be a little bit high. Maybe I'll go 5.5. 5.5 for warm compresses. Kind of along the same lines as artificial tears, where it's definitely not the end all be all. Might not work for a lot of people, but it definitely can help, or maybe scratch the surface to helping those Meibomian glands and the oil glands in your eyelids. Also makes them feel better. Yeah, so I'd put it at the 5.5 range.
Yeah, I'm going to be close to yours. I'm going to say a 6 on warm compresses if done regularly. If they're done sporadically, then I'm going to rank them a whole lot lower, like a 3.
Oh yeah, okay,
you know
okay,
what I
that's good. See, that's good. Okay. Yeah.
Well, yeah, just because if you're doing it regularly, those, you know, you're going to get much regular, you know, oil making its way out of the Meibomian glands as intended, and it'll be softer and be able to express easier, where if you just go once a month, you're just expressing after that oil's hard. And yeah, if done regularly, I'm going to say if patient's compliant, maybe a good 6 or 6.5 on it.
Okay.
Yeah.
Yeah, that's good. Okay, yeah. I like it.
Cool.
I like that answer. That was good. Now, number 3, along the same lines as warm compresses, sometimes these are done together, are eyelid massages. So a lot of times
that's good.
Doctors will prescribe warm compresses, and sometimes they'll say follow it up with eyelid massages to take advantage of those warm oil glands. So I'd put it on the same lines, maybe 5.5, 6. Definitely want to be careful with eyelid massages and how much pressure you're using. You want to do it correctly, but can also help the patient along. I have patients that have said that it helps just by doing warm compresses and eyelid massages by themselves, like without using artificial tears or anything else. And so, yeah, I put it on along the same lines, 5.5, 6.
All right, I'm gonna give that one a 5, close to yours there, just because it's a good thing if you can do warm compresses and then do a follow up with your eyelid massage that's done correctly. That could be good. And you have a video on your channel that I've seen that teaches a proper way to do it. But for me, myself, and this might be my own personality, but taking the time to do warm compresses is already hard, and then following up to taking the time to do a massage, for me that's hard. So I might almost give it a 4 for me, because I'm just the type of person that's easily distractible, and so it's going to be hard for me to take it to the warm compress and then also to follow up with it, like take that much time for myself, you know what I mean?
Yeah.
So yeah, 4 to 5 on that.
All right. Next one on the list is the 20-20-20 rule. We're going to put this in the list of dry eye treatments, and I'm actually going to put this higher. I'm probably going to put this as an 8, maybe an 8.5, because I do think a lot of people have dry eye symptoms from staring at screens and their phones a lot. Blink rate drops by 60%, and that's where a lot of the dryness and inflammation and redness comes from. So the 20-20-20 rule, every 20 minutes, taking a 20-second break, looking 20 feet away, including blinking and blinking exercises in there, can actually make a huge difference. I tell my patients to do that as much as they can, and I think that can make a big difference, and so I'm going to rank it high, and it's cheap to do. It's free. So yeah, that's high on my list.
Yeah, me too. I'm going to give that one a solid like 7.5, because it's effective for one thing, and the name is really cool at the same time too. 20-20-20 rule.
Yeah.
I just like saying that. 20-20-20 rule, 20-20-20 rule. So
I do have written down here blinking exercises right by the 20-20-20 rule. I kind of lump it all together, the 20-20-20 rule and doing blinking exercises together. And so I'd rank it the same, 8, 8.5 for me. Because I usually tell people to do it in that 20-second time period, or kind of combine that a little bit.
Yeah, I like the video that you did on blinking exercises, by the way. If you want to know how to do it, watch it. It's really, really good. I'm going to give that one a high one. That's going to be an 8 for me on the blinking exercises.
Cool.
That's a really good one.
Next one I have is omega-3 supplements, fish oil.
Oh yeah.
Yeah, so I'm going to put this one really high as well. We're going to go up to, I might do a 9, maybe an 8.5. It's close. It's high up on the list of I'd consider this one of almost the baseline treatments or baseline things you need to be doing or taking in order to be treating your dry eyes, especially if you're in that Meibomian gland dysfunction, oil gland, evaporative type of dry eye stage. Then omega-3s, if you're not taking any supplements, fish oil supplements, omega-3s, it's out of your diet, that would be top on the list to do.
I'm giving that one a solid 9, just because I know that, in our country we have that omega-6, omega-3 imbalance. Omega-6s are much more readily accessible than the omega-3s, and we know that based on research, the marine-based omega-3, like fish oil, definitely does move the needle faster than other dry eye supplements as far as giving people relief from their dry eye symptoms. Very good for the oil and the Meibomian glands and the eyelids as well. So fish oil, omega-3, yeah, that's going to be a 9 for me if there's a deficiency especially.
Yeah, it's huge. And I've seen a lot of my patients, when they take fish oil, omega-3 supplements, that tends to be one that does make quite a bit of a difference in their dry eye symptoms. Now, there are a lot of people out there where taking omega-3s and fish oils, they don't notice a difference at all, and maybe it's because the brand they're taking, or it's just not what's going to help them. But there are a lot of people out there where it does, for sure.
Yeah, definitely different brands make a difference. Some companies will purify the ethanol out of the fish oil better than others, and if you go buy a bottle of omega-3s that's on sale at Walmart, you might have a greater chance of getting the nice fish burp side effect versus if you get it in a more reputable place, it's more concentrated, you'll have less of that.
Okay, next one on the list is neurostimulation. Now, all these that fall in this category are Tyrvaya, it's the nasal spray, iTear 100, it's an external stimulator to kind of vibrate that trigeminal nerve in the nose, and it can help improve your baseline tears. Now I'll probably put that right now at a 6.5, maybe close to a 7. I have had a lot of patients where they've used it and they like it. It's a little weird. It's usually for the patients that are kind of sick and tired of doing eye drops and steroids, and like they just want something different. That's a good different type of dry eye treatment for sure. So I'd rank it a little bit higher. Yeah, what would you say?
Yeah, it's definitely good to have a lot of tools in your tool belt. So
Yeah.
neurostimulation is a great one. At the same time, though, it kind of reminds me of being able to do something else that could cause some immediate dry eye relief, and that would be getting like your best set of tweezers like in your bathroom drawer and finding like a nose hair and plucking like 3 at a time out of your nose and getting like an immediate like tear response. Neuro stimulation there, right?
Well,
And so
I wonder if that's the more
Part of the coast of the
reflexive
nerve.
like tears that are coming out from like
Probably.
plucking nose hairs maybe. I don't know.
But no, definitely that's effective. It's
Yeah.
effective, and so I'm gonna give it high. I'll give it a 7.5. I mean,
okay.
you know, comfort is where it starts to drop off, though, probably a little bit, right? I don't know. What do you think?
Yeah, it's just different, you know.
It's
so
different.
Yeah. You know, you get the sneezing side effect, and Xiidra, you are using a medication still, but the external one you're not. It's just different. I don't know. Yeah.
But effective, though. So
Yeah. I
like it.
actually like it for myself, but I mean there are some patients that are like, meh. You know, it's
Right.
different. Yeah. Okay, so next one on the list, I put this as Eyelid Hygiene. Now this can be grouped with eyelid wipes that you can get, or there's more serious treatments that you can get like new lids and Meibomian, where you can actually scrub the eyelids down. Now Eyelid Hygiene, that overall I'd rank that very high. We're talking 9.5 for me. Even if it's just an eyelid wipe. Usually people that are in that category of maybe blepharitis, they have some inflammation, making sure that the eyelids are clean, eyelashes are wiped clean, get all that debris off, that can help significantly with inflammation and dry eye symptoms. I like new lids a lot. I still use it quite a bit. I like Meibomian, which is a more cost-appropriate type of dry eye treatment that you can get, and I still use that a lot as well, and I still use eyelid wipes. So yeah, 9.5 for me. That's really high on my scale.
I'm going to agree with those exact same numbers, between a 9 and 9.5, because it goes after so many different things, having good lid hygiene, but it gets to the root of evaporative dry eye by decreasing inflammation in the eyelids. That inflammation chokes out those oil glands, which are so important because our top layer of our tear is made up of oil. If that oil layer is not there, our tears are evaporating too fast. It's more of like a long term. It can have an immediate effect on things like eye allergy symptoms, eye itchiness, irritation due to the other thing that it does, which it cleans the filters, which are the eyelashes, from dust, pollen, bacteria. So it can have immediate effect there, as well as the appearance of the eyes look more healthy when you're using them too, physically less pink and red. But it has a long-term good effect on preventing evaporative dry eye by protecting those oil glands from that chronic inflammation from those irritants that get caught on the lashes. So
right, and
it's a mouthful, but.
And if I see a patient with even just a little bit of blepharitis or like kind of inflamed eyelids and they're suffering from dry eyes, that's one of the first things I start telling them about is eyelid hygiene related type of treatments with the wipes or whatnot. And so that's on the top of my list, and I think that makes probably one of the bigger differences in my patients as far as treatment's concerned. So.
And it's so simple. We talk about warm compresses and lid massages and different things like that, but so easy to do a quick lid scrub, especially with the pre-medicated ones that they're making these days. You probably have some of those listed in the description where you could go find some if you're not sure where to get some of the best brands. But yeah, they're so easy. You can take them with you. If you're out camping and you're out in the dust, you're out on ATVs and you're on your way home, you could do a lid scrub right there, get all that dust pollen right off your lids, lashes, brows that fast for the drive home, that fast. So,
right.
Yep.
Yeah.
Very high.
And like you said, I'll have all those in the description below if you want to check them out and check out the cost of different wipes and treatments and all that. So, ready for the next one?
Ready.
Punctal plugs. So punctal plugs can be tricky, but I'd still probably rank this at a 6, maybe 6.5, somewhere around there. My reason being is punctal plugs, I've become a little bit more selective on what patients I'm going to put punctal plugs in, because sometimes they can not work, or sometimes it can be detrimental, for someone that has a lot of inflammation and buildup in their tears. You don't want to block that, plug up their drain for their tears and keep their tears in there longer, causing possibly a worse issue than what needs to be. And so, but there are some people that I'll put plugs in and boom, they're wow, their eyes feel great. And so I'd put it just above normal, 6.5. I still do plugs.
Yeah, I definitely fit multiple types of plugs. I'm going to give it a solid 7 because it does provide that immediate effect, like same day, slowing down the rate at which your tear drains off the eye and into the nose, which is its normal current.
Yeah.
But yeah, they do dissolve out if you're doing the temporary ones. Sometimes the permanent plugs, people see just the very ends of them. They don't like that, or they're a little uncomfortable because it's stretching the tear drain a little bit when you put it in. But it does provide an immediate effect. But if you put it in the wrong patient who's not aqueous deficient dry eye, and you cause excessive tearing, and you use a temporary plug that's deep and you can't get it out, then you might cause some annoying tears dripping down their cheek for a long time. So for the right patient, taking all that in consideration, I'd still give it a good 7. That's immediate result though. That's a good one right there.
Good for the right patient.
Billable to their medical insurance too, patients like that.
Yeah, true. Yeah.
Yeah, so it's pretty high.
Okay, next one on the list is Restasis, Xiidra, Cequa. They're kind of all in the same family of medications, prescription eye drops that we can prescribe patients to help with their tears and dry eye. I would probably say 3-4 years ago, I would have ranked him at a 7.5, maybe an 8. But now I feel like we're maybe at a 6.5. It's a little bit lower. I don't prescribe it as much as I used to because I'm finding other success with different eye treatments or dry eye treatments that were Restasis and Xiidra and Cequa was kind of taken on the back burner and can sometimes be annoying dealing with insurance and how much they cost for the drops. And so, I don't know, what would you say?
I think that we can just prescribe a medication and kind of mask the problem and have it take months to kick in, or we could go after the root of the problem. I'm going to throw out a 4.5 on those. So I'm going pretty low on them because I don't feel like they go after the real cause of the dry eye. I feel like there's so much more that can be done by other means that can take care of a person's dry eye 10, 20 years ahead. And the drops, 10, 20 years paying for those drops without going after the root of the problem, I'm going to rank it pretty low. So
that's true.
I'm not anti-medications or anything like that. I think there's a place, but I'm tossing that one pretty low.
So I'm in the same. It's starting to rank lower and lower because I'm finding other things are helping the patient better and better in the long term, especially. So I agree. Okay, so next one on the list is diet. Now diet, we could do 50 videos just talking about specific diets and foods and supplements maybe that can help with dry eyes. Now diet alone, if I was going to say, okay, if a patient had dry eyes and we talked about their diet and said, hey, we're going to change your diet to be more conducive to help treat your dry eyes, that's a huge one for me. So a lot of times that is what is causing the inflammation. A lot of times, not all the time. So I'm going to rank it up to like 9.5. If someone can change their diet, reduce their inflammation overall in their body, that makes the biggest difference that I've seen as far as dry eyes and dry eye symptoms, but can also be the hardest one to deal with. And so high ranking on the dry eye treatment, probably also the most difficult to figure out.
Yeah, that reminds me of our little discussion on omega-3s a little bit. And you got to stay hydrated to get those tears in.
Yeah.
That's absolutely at least a 9.5, if not higher for sure on diet. I'm going to agree with you on that one for sure, as far as dry eye treatment long term.
Huge.
Yeah.
Okay, so now we're going to get into some kind of in-office treatments. They might be a little bit more expensive, but can be designed for dry eye patients. One would be scleral lenses. Scleral lenses specifically for dry eye patients. I kind of rank this a little higher, maybe a 7, could be a 7.5, and also kind of patient dependent. It seems like I have some patients that do quite a bit better with scleral lenses if they have certain types of dry eyes. But we just had a continuing education class where we were learning pretty much anybody can benefit from scleral lenses that have dry eyes. But that's probably where I put it, 7.5. Can be a very useful tool in the dry eye tool bag.
Yeah, scleral lenses, basically they trap a little bubble of fluid underneath the contact lens and the surface of the eye. So that's how they work. I'm going to rank that one very high as well. There's a couple types of dry eye. There's the aqueous deficient, in other words, we don't produce as much tear as we once did. And then there's the evaporative type, has to do with oil gland dysfunction. But yeah, there's a lot of aqueous deficient dry eye individuals that could benefit. There's also just people of both types, combination of both types of dry eye that would benefit from it as well. But yeah, blanking the surface of the eye in preservative-free saline all day long that works for everyone. If it doesn't work for someone, it might have something to do with maybe they weren't quite patient enough letting their eyes adapt to using that scleral contact lens. But yeah, it sharpens the vision at the same time. You can use it for if someone has Bell's palsy and they can't close their eye. You can either patch their eye, sew it shut, or you can do a scleral lens on their eye. And it's, I'm going to rank that one pretty high.
And I have quite a bit of patients that were on it. I mean, it's pretty much takes the patient from where maybe they couldn't really function in life. I mean, their eyes were so dry, they couldn't drive, they couldn't go to work, they couldn't work on the computer, and then scleral lenses turned it around to where they can work, drive, do whatever they need to do. I mean, there's a little bit more of a process, like fitting the contact lens on the eye. There's a little bit more involved as far as getting the scleral lenses and the cost and insurance and everything, but can be a nice treatment to have for sure, and I think could benefit a lot of people.
Yeah, and it does so for a lot of other conditions too, like keratoconus, post-corneal transplant patients that have very irregular shaped surfaces of their eye. And with this lens, since it blankets the surface of the eye, it can basically essentially create a brand new smooth surface to where it can focus their eyes better than even their eyeglasses can. Yeah. And so such a cool while treating dry eye at the same time.
I bet scleral lenses and dry eyes, my guess would be it's going to become more and more popular down the years. I feel like it already is. I feel like I do more of it for dry eye patients, and so I think more and more doctors are going to utilize the scleral lenses.
I agree.
So next one on the list is more often a in-office treatment, thermal eyelid expression or Meibomian gland expression. That could be your LipiFlow, Ilux.
There's a couple others out there.
Yeah, so pretty much you go to a doctor's office, they have these tools, these devices to actually specifically heat up those oil glands and express the oil out of the oil glands for people that have Meibomian gland dysfunction or evaporative dry eye, and can be really helpful. I would rank it this is another one of those things where if you asked me about 2-3 years ago, I would have ranked it at an 8. I was seeing a lot of success with it. Maybe now I'd put it down at a 7.5. Still kind of high for me though, but I have had a lot of patients that it has helped, but also quite a few patients that it didn't do anything. So that's a hard one as a doctor because it is costly to the patient, to the doctor, but specifically to the patient, and it's a hard pill to swallow when the patient's like, it didn't help at all. And so it's a rough one. But I have had a lot of patients that it's helped quite a bit.
Yeah, that's definitely one that we do in our clinic a lot as well. Is we do the Ilux version of it, and we have a lot of success with it. There are those patients that do come up once in a while as well that you either have to repeat it, or they say, well, I'm still getting some dry symptoms. How often do I need to repeat it? Stuff like that. That being said, when that oil hardens in the gland, doesn't come out and coat the tear, and the tear's evaporating, if it's a pretty severe case, you get some good solid results. You want to almost give that thing a 9 or a 10, but then those other cases you want to rank it a little bit lower. I'd give it an 8. I still like about an 8 on it. Yeah.
Yeah, good. So still high up there.
Mm-hmm.
Yeah, good. Okay, next one, also an in-office procedure treatment, is IPL, intense pulsed light. We have it in our office. You have it in your office.
We do, yeah.
So far, I've had amazing results actually with IPL. I'd rank that up there in the 9s. So 9, maybe 9.5. A lot of it because you do get a lot of other benefits with IPL. And not just dry eye benefits, but it can help with Demodex blepharitis, if you want to hit that. It can help treat styes in the eyelids. This is one that you do usually need multiple treatments, and it kind of gets better over time. But as far as patient success with improving their dry eye symptoms, yeah, I'm up there in the 9s, 9.5s. Really good.
Yeah, I'd agree. It's an investment to get into it.
Yeah.
For that reason, I might give it an 8.5 to 9, somewhere in there, just because it is, some people are like, sign me up, I need this really bad.
Yeah.
I don't care what the cost is, I'm going to invest in my eyes, I value my vision. And then other people, they've got to save up a little bit to do it, or maybe do a care credit or something like that, because it's usually not billable to medical insurance.
Right, no.
And
yeah.
so that tends to be the only thing that complicates it. But yeah, the benefits, the collagen stimulation, the way that it can be effective against preventing styes or treating styes on the eyelids, and treating eyelash mites, and just fixing rosacea on the skin, and it's aesthetic reasons. And there have been studies that have shown that is about the only thing that can show that some of the oil glands actually re-lengthen that people have lost in the past, as well as with IPL. And so that's probably one of the best treatments out there to go after the very root cause. I'm going to rate that one I'm going to give it an 8.5 to 9.
Yeah, definitely a high one.
Yeah.
Okay, thanks for watching the video. I'm sure there are a lot of dry eye treatments that we didn't talk about. There are a lot out there. But if you have a specific treatment that you want to talk about or comment about what has really helped for you and your dry eyes, definitely leave it in the comments below. Or if you would rank one of these dry eye treatments as completely opposite of what we ranked it. Like I said, a lot of it is opinion based, and so I'm kind of curious to see what you have to say. Or if you want to learn more about dry eyes, you can check out my playlist right there. I'm Dr. Neil Guymon, Dr. Eye Guy. This is Dr. Smith. Stay focused.